Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Now let's look at the pattern. The pattern of the drug and the toxin induced hepatic injury. So looking at the cholestatic pattern. The cholestatic pattern, the causative agent is a contraceptive as well as the anabolic steroids. Then looking at spotty hepatocyte necrosis. So this involves the methyl dopa and the phenytoin. So cholesterol pattern is contraceptive and anabolic steroids. Now moving on to the massive necrosis. It involves the acetaminophen and also the halothane. And looking at the chronic hepatitis, this is isoniazid. Then the large and the small droplet fat. This is nothing but the ethanol, the methotrexate, the total parenteral nutrition. Now they're looking at microvesicular steatosis. That is valproate tetracycline, aspirin, the Rey syndrome and the HAART. Then the steatohepatitis with the Mallory-Denki bodies. That is ethanol and the amiodarone. Then fibrosis and the cirrhosis. This includes alcohol methotrexate as well as the enalapril, vitamin A and the other retinoids. The non-seizating epithelioid granulomas, they involve the sulfonamides as well as amiodarone and the isoniazids. Then comes the fibrin ring granulomas. Fibrin ring granulomas, there is a sulfonamides, the amiodarone and the isoniazid. And the fibrin ring granulomas, it involves the allopurinol and the Budd-Chiari syndrome. BC syndrome, it is nothing but the oral contraceptives. To learn and grow daily like this, please do subscribe.